Okay, and we're live. Welcome, everybody. This is Dr. Sarah Merritt of Lifestream Health Center in Bowie, Maryland. Chronic pain specialist. We treat patients with acute and chronic pain. Excited to welcome to our broadcast today Dr. Ruth here. She is a physiatrist, and she is doing chronic pain coaching with a business called Chronic Pain Rescue. And I was just telling her, I'm going to ask with some legitimate curiosity. I have not personally worked with a pain coach or referred anybody specifically to a pain coach. Help me understand what that is and why a patient might need or want to work with a pain coach.
Yeah. Well, thanks for having me. First of all, I really appreciate meeting with you today. So I've been doing physiatry, physical medicine rehab for over 20 years. And I just felt a heart towards people with chronic pain. It seemed like many of them weren't getting any better despite, the different medications they were taking, having physical therapy. And it just made me more curious to know what things are available to them. And I also have just a personal interest in holistic approaches, and just the things that have blown me away to find out that food is medicine, exercise is medicine. And I think that people with chronic pain are often sort of on their own, trying to deal with what's going on. Their families don't understand, their friends don't understand. So I think that a pain coach is something that can help them, to come alongside and be a partner with them in their healing, at least to have a better life than what the chronic pain leaves them with. So
that's awesome. And so it sounds like it, and I think you said this, but it's a holistic approach to look at, I guess, what we might call lifestyle factors that in addition to other things, but optimizing medication, optimizing, well, medication, sure, but mental health, diet. These would be all things that you would work with in terms of optimizing somebody's life.
Right.
And I guess how, if you're working with a patient as a pain, if you're working with a patient as a pain coach, then you're probably not prescribing them a medication, although they might have a medication from another doctor. Is that right?
Right. As a pain coach, and especially because I'm online, I'm not able to examine them in person. So I do encourage them to continue with your regular doctor, because there are things I'm not going to see, not being able to examine you in person. But that being said, there are supplements sometimes that people don't recognize can help. I just helped a young woman who's had headaches for 3 years with just a supplement. And she's actually much, much better. So, there's different things that we're not necessarily familiar with, but they do have evidence-based, results, and they're worth adding to what you're already doing. Getting enough sleep, learning how to handle stress, because we know that stress, that just that fear of the pain, that threat, they can escalate in their minds, oh, this is getting worse, it'll never get better. And all of that stress causes physiologic changes in their body that helps to increase the pain. They don't recognize that. So just to learn how to calm yourself and learn how to relax and learn how to think differently, it can make a huge difference.
And that's a journey that I would imagine takes some time, but at the same time, there are probably like quick wins or things that we could learn briefly that might make a meaningful difference. Can you share a quick win, like something that might help with stress or easier sleep? Do you have any quick wins for our viewers?
Oh, well, aromatherapy. I know of someone I thought was very, as a relative, I thought she's kind of hyper, and I, I sent her a aromatherapy kit, and she said the lavender just put her right out. She went right to sleep. So, but not everything
Wow.
works on everybody, but yeah, yeah. So, it's an interesting thing. There are lots of things out there. I figure, especially natural things, not always, because granted, some things, because of different diseases you may have or different medications you may have, they're really a contraindication. So you
Yeah.
can't just blanketly say because it's natural, it's going to help each person, or that it's beneficial for each person.
Right.
Sometimes there's contraindications for things. But in general, there are a lot of things out there. The combination, I figure, helps. And so it's not any one thing. Some people kind of don't like that because they feel like, well, how do you know it's working if you have to have it with something else? But I do think that chronic
Like
pain is
a supplement if you have to take it with something else.
right. So, or I'm just saying, if you have say you're doing an anti-inflammatory diet, but you're also doing yoga, you're also doing, when I
Okay.
say it's multiple things,
Okay.
it's not the one thing, it's the combination of things. Yeah.
Okay. Okay. Yeah. The idea that the whole might be more than the parts.
Right. And really, you
Some
think
is maybe
about,
more than the part.
right. You think about, if pain's been lasting this long, it's not going to go
Yes.
away in a week, usually, or 2 weeks. It's going to
Right.
be
Yes.
a gradual process,
Yes.
and you can set goals. Just say breathing exercises, because a lot of times people hold a lot of tension in their bodies, and if they learn how to
Yes.
do meditative breathing, that will help control
Mhm.
that, help release that tension. It can make a difference. And that would just be one step. That's not the end, but it gets them further along.
Yeah.
So
One step along the
yeah.
way.
Hmm.
I love
Yeah.
that idea too, and I acknowledge that very often with my patients. It's like, look, you have a hard pain problem. If this was easy, this would have already been fixed. And so this is
Right.
going to like take some time, and often that like multimodal approach of not one thing. Okay, there may be a medication, there may be some medications, and then
Mhm.
what else? In our practice, sometimes that's injections or physical therapy. In the coaching world, it might also go further into those other holistic options, including dietary modifications and
Right. Right. And
yoga.
there's some
Is
things.
there a specific?
Mhm.
No, go ahead.
Oh, I was
Oh,
going
I
to
was just going to ask
say,
if
go ahead.
we just got a lag. We've just got a lag. When you say what you want to say, and then I'm just going to have you tell us about diets that you like. Is it anti-inflammatory for everybody, or are there different ones? But
Oh, okay. Okay. I'm trying to remember what I was going to say.
well,
That
I
it
know.
just escaped
Sorry.
me. But anyway, I really,
The joy of alive.
I only know a couple of diets. There's the elimination diet, which is not a
Mhm.
permanent thing. That's when people are looking to see if they have certain food sensitivities. So they limit themselves to just a couple of things to eat for maybe at least a minimum of 21 days, so that you get all
Yes.
of, whatever out of your system. And then every 3 days, you add one thing back. So let's say, you're not eating wheat products or pasta, breads, or whatever. You're not drinking
Mhm.
milk or dairy products. And so you'll gradually put one thing in, and see if your body has any reactions, over
Mhm.
3 days, and just slowly reintroduce things into your diet so you can know what you may or may not have a sensitivity to. People may not even recognize. It's funny. I've seen sometimes where people have a very favorite food, something that they just really love, and they didn't know that it was causing symptoms in their bodies, because they
Wow.
eat it all the time and they just don't recognize it. There was a doctor that I met who said that she found out she has restless leg syndrome from sugar. And
Oh.
she had done an elimination diet. When she reintroduced sugar, she realized that that's what that was coming from. So So I don't know a lot of different diets. I know
Wow.
there's a lot of diets out there, but the
Yeah.
anti-inflammatory one I know, and the
Yeah.
elimination one
And so you
I
work with
know. Mhm.
And so you work with patients that want to do an elimination diet and look for food
I can.
sensitivities
Yeah,
to
I
influence
can.
pain. Yeah. Mhm.
Mhm.
I would share, and I've shared this with a patient or two, but yeah, I did an elimination diet recently. I guess fall of 22, and
Mhm.
the PA in my practice, Denara Farron, actually does some work with patients on elimination diets if they want to. But
Mhm.
it's hard. It's a big ask, and
Yes, it is.
eliminated and really just related to like some abdominal bloating, not even related to a chronic pain problem, but
Right.
eliminated a lot of things and
Mhm.
over 6 weeks. And then the adding back I found was actually very challenging, just to do
Mhm.
it in a very systematic and controlled way.
Right, right.
There's just been some challenges with that, but yeah, I
Yeah.
definitely, I do not have celiac disease, but I have found that gluten, is a bit of a trigger for me to have bloating and discomfort, and apparently that's just more common, I think, than a lot of us
It
realize is
it is, it
is how
is.
food sensitivities can impact.
Right, right,
Yeah.
right. I've had
Well,
the
that's
same
good.
experience. Mhm. With the bloating,
Mhm.
certain things. Yeah, for me,
Yeah.
it's more
Yeah.
dairy.
And so I yeah, okay, okay. Well, and I think certainly, if you're working with a patient for an elimination diet or for changes, are they going to keep a journal? Like, how are we going to track those outcomes? Because for me, and even in my medical practice, sometimes that's one of our challenges. Is, how do we track how patients are improving? How are we recording? There's a lot of just a conversation that happens organically and understanding what somebody perceives and what they're going through. But there's
Mhm.
more than that. What are the things we can quantify in terms of functional status or whatever? How are you?
Right.
You're trying to measure, like with a pain score. Do they journal? How do you work with that?
Yeah, that's a good question. I do believe in journaling, and I think that's important. My chronic pain rescue is still yet to launch. I want to have some other things that are more concrete measures. Particularly functional. I've noticed that
Oh, okay.
when people can
Mhm.
function better, they recognize the value, and the pain is not as important. And I think someone that's on the front side of that, they don't see that, but on the as they go through it, the function is so much more important. Not that it's okay to be in pain, but the pain gets less when you can actually function and do more. So I do plan to have a systematic functional analysis as well as pain to start, and also certainly looking at how they interact in their community. A lot of times people, they end up
Mhm.
being very isolated. So in physiatry, physical medicine rehab really is about helping people to be have a optimum function, and not just physically, but in terms of socially
Mhm.
and in their community. And I feel that's what I want to bring with the chronic pain, that they can really live whole lives, and optimal their best lives. So there's so much that goes into it, really, and things that people don't recognize bring health, spiritual component, not
Yeah.
necessarily that I'd be preaching to anybody, but I do try to encourage, whatever
Yeah.
your spiritual background is, are you still using that? Are you still with that? Maybe you need to go back to that. Because
Yeah. Have a
those
spiritual
foundations,
practice of some sort.
yes, yeah, yeah, it makes a
Yeah.
difference.
Yeah, I think so too. And whatever it is that resonates with you, and it might be that thing from years ago, or it might be a new thing.
Right,
Yeah, we've
right.
we've worked with some patients to teach meditation in the practice, and it's been really well received. And it's been interesting to walk that line of discussion around meditating, and maybe that can be sort of independent of whatever your religious belief is, right? You know, a lot of times that's not a grounds of discussion between a doctor and a patient, but, you know, maybe at the same time,
Yeah.
there's room for meditation, that just doesn't, that's sort of separate, you know, somehow from religious beliefs.
Right, right. It is, I can be a tightrope. I certainly don't,
Mhm.
I just know that we are spiritual beings, right? We're spiritual beings. We're not just flesh and
Thank you.
bones. So yeah,
Thank you.
so
Yes,
we
that's right.
we have to, yeah, we have to not neglect that part. And I feel that's a sad thing about science. Science is important. We're scientific, and we should use a scientific method. But we shouldn't necessarily dismiss things we don't understand just because we don't understand it.
That's right.
We may not understand it. It doesn't make it any less real, if I'm making sense. So
Yeah.
you can't
Yeah.
see
No,
the
I think
air, but the air is there, right? We know that. So anyway, yeah.
there. It's there. And we need it, and it has to be there.
Yes.
Yeah.
Right, right.
Well, that's great. It has to be there. Um, well, good. And so you are starting a telehealth coaching practice. So that's going to enable you to work with patients really from anywhere, since you're going to be working with them in a coaching capacity rather than strictly as a physician.
Right, right. That is the goal. And I'm not ready yet, but I'll just be working one-on-one with people. But I would like to have a group eventually, a group program, because again, I think that people need community, and I can see where we're having a group all working together on their individual pain issues can kind of help build them up and keep them going even once the official program is done. So I'm looking forward to doing that. But right now I'm really just trying to learn my EMR and that I'll be
Yeah.
using, and getting ready in those ways. Yeah.
Yeah. Well, and I think groups are interesting because, right, there's such an opportunity for individuals to learn from each other, and such an exchange that can happen. I think that's a really interesting aspect of it, because I think, it's one thing to have a relationship with the provider or with the coach, and you might relate with that person in a certain way, but then you might relate differently in a valuable way with another chronic pain patient.
Right, right. And I think it just helps to see someone else going through something similar to yourself. You're not alone. I definitely
Yes.
think that helps. Yeah. And I just read whenever I get to start my my group program, this African proverb, which I thought was really perfect. It said, if you want to go far, if you want to go fast, if you want to go fast, go alone. If you want to go far, go together. I thought that was
Oh, I like it.
true. Yeah. Yeah.
That is really
So,
nice. Yeah. Yeah. So helping your people go further.
right.
Very good. And so we talked a little bit about diets. We talked a little about spirituality. What are other areas that are important to optimize for patients in chronic pain? Do you have some pillars that you teach? What are we leaving out?
I don't know that we left anything out. There is, I was looking for it. Isn't that funny that you asked? There's a list of, it's just basically lifestyle medicine practices, right? So we talk about nutrition and exercise and sleep.
Yeah.
Of course, stress management or meditation, community, right? Being involved or in your community, being active, a spiritual practice. And there was one other thing. Oh, it was 7 things and I don't remember. Oh, geez. Yeah, I was looking for it. I can't.
I think that you're good. I think that idea around just motion is huge, because that's such a catch-22, right? Because our patients in pain feel like they have trouble moving, and yet we're going to advise them to move.
Right. Right. Absolutely. Absolutely. You have to push
And
against it. Take your medicine or whatever and move. So, you know,
oh yeah, there you
um,
go. There you go.
yeah, it's better. It's so much better. Your body, you know, it's on. I usually explain it in terms of a cold because it's a simple thing we all know about. Like, say
Okay.
you're feeling symptoms of a cold, maybe a little sniffles, but you have things to do, right? You're working. And so you kind of, you know, you drink your
Yes.
orange juice and your tea or whatever, and you keep going. And somehow the symptoms
Yes.
never got full blown. They just kind of went away. As opposed to when you start to feel those symptoms, you decide, oh my gosh, I'm getting a cold, and you get in bed and then you have this full blown you know, this full blown thing. It's like your body
Yeah.
responds to what you're doing and what you're thinking about it. It's an interesting interplay, you know, the mind, the body, the emotions. It's a very interesting
Yes.
interplay. So I
For sure.
almost, it's not really tricking yourself, but if your body sees that you're still moving, it seems like it makes the adjustments to say, okay, well, we're not sick. We're not sick. Okay, we're trying to move forward. I know there's a limit to what I'm saying, but
Yeah.
um, I do think it helps.
Right.
In
Yeah.
fact,
Or I'll tell patients like, look, no one's expecting you to go run a marathon. Like,
no,
that's not what we're talking about. But like, let's move a little more. How, and I don't know if you ever do any yoga, but I do some yoga, and I like to take this yogic perspective and this idea that if you work in this like safe zone of stuff you can do, eventually that zone gets bigger. Right. And it's
right.
not
That's
like a
very true.
true like athletic model of like go flog yourself and then you'll be able to run better. But
Right,
rather like work in the safe zone. And I think safety is actually part of it, right? Like you said, like
right,
your feelings and how you process it and how you understand it. Like that's super important. So you've
right.
got to be in the safe zone. You
Mhm,
got to
mhm.
move, but moving in the safe zone.
Yeah, yeah, and yoga is great. I mean,
Yeah.
I was
I
trying
think
to find a substitute, because I'm not that flexible, so but I know that I
mhm.
feel better when I do yoga, and I did try to find something. I came back to it because it is really helpful. You know, the breathing and the stretching. It's
Yes.
pretty easy on yourself. You're not going to hurt yourself doing it.
Yes.
So, you know, it's a very, very good exercise. But I would just recommend people do what you enjoy. If there's something you enjoy, you know, do that, because that you're going to want, if you already enjoy it, you're more likely to do it, you know, as opposed to
Oh
trying
my
to
gosh,
find
what good
something
advice.
that you think, you know, you should be doing, but you really don't enjoy it.
Right.
You're not,
Oh
yeah,
yeah, I
you're not
should
going to
do
do
this.
that.
That's never gonna work. Yeah.
Yeah.
Yeah. Oh, I
Yeah,
should adopt a, such and such diet, fill in the blank of something you're never gonna want
right.
to eat.
That's
That's
the other thing that thank you. I just remembered the other thing of the lifestyle stuff. Get out in nature. Get out in nature. That's the other thing.
yeah.
We don't recognize
Oh
there
yeah.
is so
Tell me
much.
about why that's valuable.
Yeah, it is really invaluable. It's interesting. I was reading this book, 52 weeks of walking 50, wait a minute. 52 ways of walking. 52 ways of walking. Annabelle Street, something like that, is the author. Anyway, all
Okay,
this
52 ways of
scientific
walking.
background,
Okay.
as to what happens when we listen to the sounds of nature, and not the recordings. You know, there are the recordings, but they said the actual nature sounds. 30% of people felt more calm with that. 40% of
Mhm.
women said they actually felt happy hearing bird sounds singing. You know, um, there's different substances, biochemical things that trees release. I was just amazed at all this stuff that actually give you a better sense of well-being. And they found that,
Wow.
you know, like young people, like high school students going outside in nature to study, they were able to concentrate more and get better
Hmm.
scores. I'm like, wow, this stuff is good. So getting out in nature really does help with everything. It helps with your mood. It helps with your, you know, peace, and
Mhm.
definitely can help you with lessening your stress and your pain levels. So I would advise, that's the last thing. I'm glad I
Yeah.
remembered that. Yeah, because that's important.
And I think I'm so glad you did too. That's great. And I put a link to this book in the chat, just not even a purchase link necessarily, just the what it is. I love that idea that because walking is so easy, right? You just need shoes. You don't need a lot of specialized equipment. And I need to look at this book, but I would imagine there are benefits to walking even short amounts in nature.
Oh yeah. Oh yeah. And it's very interesting. She apparently walked for years and years with her dog, and after her dog passed, I think she was inspired to write this book. So it's very interesting. There's so many things she has in there. Pilgrimage is one I just read about, was the walks that people do to go to a specific end, that usually has meaning. It might be to a church, or it might be just to a location that has a meaning to you, and that was interesting. So there's a lot of interesting things in in it. But all that is to say, yeah, getting out in nature can definitely help. There was someone who walked back in the 1700s. He was depressed, and he decided to walk to this waterfall every day, and he. Doing that every day, he cheered up. He got out of his depression. And apparently the motion of when the water hits the ground and you get all this steaming coming up, there's ions, right? So these are, I want to say, negative ions that come up when the water is splashing, and those negative ions are good for our bodies. Just to say, I'm not saying it in the nice scientific way that it was purported in the book, but just interesting.
And that was in Pilgrimage.
Yeah, right.
Yeah, that's awesome. I love all the good book recommendations, and also these are not ones that are known to me. Also, so I'm going to have to check them out.
Okay, sure.
Yeah, and I would share. I have a German Shepherd, and German Shepherds like to go on long walks. So we're walkers ourselves in my home because there's a lot of walking that needs to happen.
Right.
Yeah. And I can say, yeah, it feels great to get out. I thought of one more question I wanted to ask you, looking at your webpage again and what else is on there. Tell me a little about @AlphaStem. I have used it a little bit in my practice. We had a unit, and I think it went out for repair, and we just haven't gotten back to using it routinely. But so I'm a little bit familiar with it, but really more for our audience, any pain patients that want to engage here. I think it would be great for you to share a little bit about what is @AlphaStem and why would that be something that we should know about.
Okay, so I got introduced. Well, I had heard about it years ago. I heard about it years ago at a conference for holistic and integrative, and I didn't really think much about it because I didn't know, you don't know much about it, and I didn't know if there was anything too scientific behind it. But I was at a meeting more recently with some kind of medical, they deal with medical legal issues, and they had someone present on it, and it being in this setting, that's probably biased on my part, but I said, oh my gosh, well, if they're presenting this here, it must be really something. Sometimes there's things that are out there that are kind of, people do them, but there's not a lot of science behind them. So it's a good question. To be honest, I've read it. I have my own alpha stimulator. It's sending forth waves that are similar to brain waves that help decrease pain. They can also help with decreasing depression and anxiety. I was very intrigued, and I was just starting this at the same time. So I got a unit. I've used it. I've lent it out. I hear they use it at the VA with our veterans.
Yes,
so according to the company, it's a 90% success rate with people's improvement. From someone that I've spoken to who knows about its use at the VA, they said it's more like 50% have a good outcome with
Sure.
it. So as I said, I got excited that would be another tool for my toolbox. I'm always excited to have
Yeah.
lots of tools in the toolbox. So it is a tool I have.
Well, and back to the idea that, back to the idea about the risk versus benefit, I think there's so little risk to a technology like the 𝗷𝗄
Yes.
Yes. It's not the same as a TENS unit for any folks that know what that is, but similar risks and benefits, the risk of it.
Oh, you froze.
Cause any harm to this little current. Oh, yeah, sorry about that. I seem to be having a Wi-Fi challenge.
Okay.
But yeah, I think the risk benefit is very favorable.
Mm-hmm. Yeah.
Well, good. Well, I think I was just going to say, I think we covered a lot, and I appreciate you coming, and I've shared your information here in the comments. So check out the links to Dr. Ruth Reed Thornton's practice or coaching practice if you'd like to interface with her at Chronic Pain Rescue.
Yes.
Awesome. Well, thank you. Thank you so much for being with us today.
Yeah, thanks again for having me. It's been a pleasure.
My pleasure. Okay. Take care.
Okay.
Bye.
All right. Bye.
Bye. Okay.